Well, welcome everyone. This is Nancy Poole here from the British Columbia Centre of Excellence for Women's Health. I'm really excited this morning to be part of bringing to life some of the work we've been doing on creating updated resources about women and alcohol, and to be supporting thinking across Canada. There's some people from all across the country today who've joined us. In thinking about how we bring these discussions of resources to life. With me this morning from the British Columbia Centre of Excellence for Women's Health is Tasna Nathu, who's a knowledge exchange expert with us at the Centre. And really happy to have Christine Urquhart and Fran Zazira from Change Talk Associates with us. Now, Chris and Fran are folks who've been practice experts themselves and are now working as educators around guiding conversations about women and alcohol and many other topics as well, using motivational interviewing as their key area of expertise. So really great to have both researchers from the Centre and practice folks and educators from Change Talk, and especially happy also to include Teresa Chiesa with us this morning, who works with the BC Ministry of Health. So linking in government folks as well as practice folks and researchers, I think is a really important part of this work in thinking about how we all have a role in making this process happen. And Teresa's part of the Ministry of Health in British Columbia are the ones who've been supporting the project that has developed these resources and then working on making training happening across British Columbia. Now, the resource we're going to feature in the second half of the discussion today is this one that's pictured here. And just want to mention that, you know, the first version of this resource, which we have now updated, was really brought together with the help of mothers who'd given birth to children with FAS, who mentioned to us that they felt that the discussions around women and alcohol and women and use of alcohol in pregnancy hadn't really happened for them in a way that they could hear, and or maybe hadn't happened at all. And so they were really encouraging us to do it. So we really feel that this whole process that we're engaging in today is about women with the health concern, governments, people with expertise and practice, and the research, and trying to bring all that together. Now, we are not the only ones who've been doing work at the British Columbia Centre of Excellence for Women's Health around resources around women and alcohol. We're very much indebted to the work of the Canadian Centre on Substance Abuse and many others across the country who've been working to bring this low-risk alcohol drinking guidelines to life in Canada. And that will be a big part of our this morning. And they also have a small resource on women and alcohol that accompanies the larger guidelines. So we'll be talking lots about these guidelines as we go along. Those of you who've been involved, and many of you are on the line this morning, have been involved in training or education or guiding learning, I guess I should say, knowing that I've got Chris and Fran on the line with us. With sessions where we've been looking at these resources also developed in this project that are really focused on different aspects of supporting understanding by practitioners about alcohol and pregnancy. And there's 8 in this series, and lots of supports within each one. We've also been working a lot on making publications that might be something that you might want to use in the course of your practice, in the course of our work with the Prevention Network Action Team as a part of that research network. And here's a few examples of that and that website where you can download those. And I guess the message I'm trying to convey as I go through these different resources is that it will really require you to think lots about, different resources available to you as you have discussions with women about alcohol in general and alcohol in pregnancy as well. And so I'm just running through a few ideas here that hopefully will be ones that may resonate for you at different times and in different contexts. Now, the one on the left is something we developed in collaboration with the Girls Action Foundation to support the work of girls group facilitators in having discussions about with girls in the context of girls empowerment groups. And the one on the right is an example of our BC material developed through the liquor distribution branch, and most provinces have resources such as that available to them as well. And finally, a lot of the groups that are working on mental health and substance use issues per se have also been creating resources of various kinds that I think can be very helpful. On the left here are ones from Here to Help, a BC group that I've had the pleasure of working with. And you can see that there are a range of resources they have, including ones that even discuss the concept of what is a standard drink, which can be extremely helpful when we're talking about what's low-risk drinking look like to really understand what they mean by one drink. The Center for Addiction and Mental Health in Ontario has resources such as this as well, and so does a group in Quebec called Edu El Cool, and I think they're a really interesting group with a wide range of resources. And I love this one little graphic that they have as part of their posters, which really reminds people about low-risk drinking for women being 2 on any one occasion and for men being 3. I just think it's really a catchy way that they've captured it there. So, I'm going to turn it over to Chris and Fran now to talk a little bit about using resources within conversations with women, because we all know that having information by itself is not enough, that we really need to figure out ways, especially with a subject as stigmatized as this one, to really bring to life what we know and make it part of conversations instead of sticking a pamphlet in someone's hand. So over to you, Chris and Fran.
Thanks so much, Nancy, and a big thank you in terms of the team at the Center of Excellence and all the work that you're doing. As educators, it's so helpful to have those resources pulled together, to have that evidence together in such a way that we can then translate it. What does this mean, and be able to offer it and share it with women and families. So what we're talking about in many ways is actually 2 levels of empowering conversations. The one level, thinking about how do we empower service providers to feel confident in engaging in the conversation, and part of that is having at your fingertips that information and knowing where you might find more and some support around that, as well as empowering women in their own health and well-being, and what information we might share with women specifically. So, of course, no one person can do all of the work, and really thinking about the continuum of support and where might you be on this continuum. And we've had the privilege, as we've done these sessions with the first Healthy Choices in Pregnancy initiative a number of years ago, as well as the current training we're doing, to have so many different service providers in the room with us and all the wisdom that they bring. And so it's always a matter of thinking about, where am I in this? What is possible within my scope and my role, and who are the women that you're specifically in conversation with? So some of the questions you might already be thinking about as Nancy's been speaking, and you're seeing some of the options around the resources out there, is specifically who am I in conversation with? And what are the opportunities to begin introducing some of the resources, information related to women and alcohol? So, for example, if you're working in mental health and a woman's talking about stress and anxiety and how to manage that, how might you then begin linking to how is she coping and where might alcohol fit in? Or if you're doing postpartum visits, home visits, and there's conversations around breastfeeding, how might you then bring the conversation of alcohol in to see what does she understand about breastfeeding and alcohol, and what does that mean for her? So you're always thinking about how do you tailor the resources to best meet the needs of those you're working with. And the question always comes up, there's this feeling of there's so much to do. So really grounding in what's possible and how can you be most helpful in your role, knowing we have this continuum of support. So the hope is that she may be having a number of conversations with similar messaging throughout her interactions within health and social services. And the other part of that is connecting with other service providers. So who else or what other services can you connect with to really be thinking about integrated support, resource sharing across service providers, and how do you share that information with each other as well as the women in the community. And so when we're thinking about sharing information, within empowering conversations, the purpose isn't to deliver advice. The emphasis is on fostering change and engagement with her within a supportive relationship. So it's not that we lose engagement as we go into sharing resources, that it becomes part of that empowering process. And so if you just kind of pause for a minute and think about, oftentimes we can identify when we've had an experience in our own lives. So considering a health conversation that maybe you were a part of, a family member was a part of, in which a resource or information was shared that really stayed with you, that it made you think, it made you want to know more, you reflected, and maybe even you felt like you wanted to come back and continue the conversation. And as you think about that and connect with that experience, asking yourself, what was it about that conversation that helped you to feel empowered? And oftentimes in our teaching and in our conversation and work with people, we hear people say that, I felt heard, that my doctor noticed that I was getting overwhelmed and they slowed down and they checked in with me, that I was given choice and I was given opportunity to ask questions, that there was genuine compassion for my well-being. It wasn't just about the person doing their job. They really cared. And that I was asked about what I thought before I was told, and that this overall sense of not feeling judged. And so as we connect with our own experience, that also helps to inform us and increase our empathy and compassion as we work with others.
So motivational interviewing, or MI for short, helps us practice how to build on what we've experienced and how to guide these conversations that do both, that share information and resources and create a supportive relationship that foster change. So MI offers a simple to remember 3-step strategy in sharing information and resources that first elicit what she knows so we can tailor our information, and get permission to share the information. Next, provide the information and resources tailored to her situation and to her that will be helpful to her. And the final elicit, closing with the elicit, where we ask what she's making of it. We invite her voice, her understanding of what has been shared. So we'll talk more about this 3-step approach, but we're going to first of all hear a conversation about what it might sound like. So we've chosen a generic situation we hope everyone can relate to. And so what listening to this is about a 5-minute conversation. We invite you to listen to the quality of the conversation. And if you would, type in the Q&A box maybe one word that describes the overall approach to you. And if it's helpful, you may also want to listen for the transition points between these 3 distinct steps of elicit, provide, elicit. So Chris, can you start us as a service provider? We're going to pick this conversation up midstream with a woman, and where we see an opportunity to introduce information and or resources.
Okay, thanks, Fran. So Fran, as we started our conversation today, you mentioned you've got so much going on and you're really under a lot of pressure right now, and you're doing the best you can to handle all of the stress. And one of the ways that you mentioned that you've been managing it is to have a couple of drinks at night to kind of clear your head from the day. And I'm wondering if it would be okay if we touch back into that conversation in the time we have left. And the reason why I bring that up is that, we're learning so much more about women's health and links with alcohol.
Yeah, that could be helpful.
So I'm just wondering what you might have heard about Canada's low-risk alcohol drinking guidelines for women, as I know for many women that this can be new information.
I haven't heard anything about that. I mean, I have my own rules that I follow. I certainly don't drink so much that I pass out, and I never have more than a couple of glasses of wine on a weeknight.
So you're really paying attention, and you're keeping an eye on how much you are drinking.
I guess you could say that.
Some women find it helpful to know that there actually are guidelines to help reduce the risk of health and safety concerns related to alcohol use for women. And I wonder if you'd be interested in hearing more about this. It's really up to you to decide what might be helpful in terms of what I share with you.
Yeah, if there's something more that you think that I should know that would be helpful, that I don't know already, for sure, yeah.
So, of course, recognizing that, every woman's body is different, there are these guidelines, overall guidelines, that help women just kind of think about where alcohol fits in their lives, and they actually suggest daily and weekly drinking limits based on some of the research that's linking drinking levels with increased risk for cancer, stroke, heart disease, as well as other concerns such as, it's important to be thinking about how it fits with problems in relationships, and for some women, even unintended pregnancies. And so, for example, what they recommend is kind of 3 key things you might be thinking about, is that for women that do drink alcohol, that they don't exceed 10 drinks a week. Secondly, they have no more than 2 drinks on most days. And thirdly, that you're consciously building in days where you're not having a drink.
Well, I don't drink more than a couple of glasses of wine at night, but I do that most nights. That adds up, I guess, if I think about it. I'm definitely over that 10 drinks a week limit at times.
So it sounds like you're kind of surprised by this, and you're thinking about, what does this mean for you? What might it mean for you?
Yeah, I am surprised. This feels pretty normal for me and many of my friends. I guess we just haven't given it much thought.
Mm-hmm. Well, as I said, these are general guidelines to help women think about where and how alcohol fits in their life, and it's also important to take into consideration factors like age, nutrition, life circumstances, stressors, family history. The guidelines also offer some suggestions of how you might minimize your risk as well.
So you're saying these are low-risk drinking guidelines? Maybe I don't know enough about what the risks are that you mentioned.
So you're kind of wondering what else you need to know.
Yeah, I'm kind of surprised by how this conversation's going.
So knowing that we only have a few minutes left, and today's kind of been an opportunity for us to begin this conversation, and putting it out there, if it would be helpful, a couple of options. I could give you some resources to take with you, or some websites for you to take a look at on your own time. And then also, if you want to explore this further, we could set up another appointment to answer any questions that might come up for you.
Okay. Let me think about that. Yeah, I'd like some links to information that links that are reliable.
Mm-hmm. Mm-hmm. Of course, you want to make sure that you can trust the information. And I really appreciate your willingness to look at this with me, and knowing this wasn't what you were expecting today. So as we wrap up, I just want to check in with you in terms of, what might be staying with you from today in terms of what we've talked about.
Well, I certainly have got some thinking to do. I just haven't thought much about it, like I said. Sounds like I need to find out a little more and think about what it means to me in my busy life. Yeah, you've given me some food for thought.
So it sounds like, in many ways, you've got more questions and answers coming up. And so how about I get that information for you, and if you like, we can book another time where we can sort through some of this together.
Oh, that would be helpful. Thank you.
Okay, so we're going to come out of roll now and just take the remaining time that we have in our section of the presentation to just talk a little bit through what just happened and some of the key points and what we hope to demonstrate. And of course, those of you that know our training and know anything about MI, ideally we would be drawing this out of you and asking what you noticed, as we did with the questions for prompting. So in many ways, the one thing that we'd ask that you think about, or even write a note in terms of what was the overall essence of the approach, how would you describe that? And so the hope is what you're hearing are some of the themes that are coming out of what you notice is that the intent was that there was a sense of partnership and collaboration. You know, let's look at this together. We can look at this information together. That there's overall acceptance, and part of acceptance is also respect for autonomy. And so making that explicit in terms of statements like, if it would be helpful, it's up to you, you know yourself best, what you do with this information. And compassion, that's overarching in all of the conversations that we have. And so really recognizing in this example that, you know, she's under a lot of pressure and she's doing the best she can do to manage it all. And evocation, consciously and purposefully working to draw out what is her understanding, what is her perspective. So it's really about, when we're talking about the essence of an approach, it's really about putting both the relational parts of the conversation with the technical together, and the technical being the resources or the information. If we have one without the other, we need them both together. So it's the skill to be able to use the resources in a way that is empowering for women.
And so then the next slide, Chris. So the technical is also can be this strategy, this elicit, provide, elicit. So within that, the essence of it, within the quality of that relationship, we also wanted to demonstrate in that role play the elicit, provide, elicit. So that first elicit, when Chris asked what I was the client in that situation, what I already knew about it, I didn't know anything about it. I hadn't heard about the guidelines. And then when she asked me, when I commented that I didn't realize there was risks associated, this low risk, and asked more about the risks, then she heard what I wanted to know. And she also paused and just asked permission to share, and I felt really engaged in that conversation, like she was building a relationship with me. So the how she did that first elicit, and then the why underneath it, building the relationship, maintaining engagement even as she's sharing information. And she evoked my wisdom, my understanding on that, what I knew about that, what my situation was. So then she tailored the information to me, and through that there was a tone, that tone that we've been talking about, of acceptance and choice, when she said, it is up to you what you do with this. And so there was a few places there where I felt like she was strengthening my choice around this. It wasn't just that this was a one approach for everybody, one canned approach.
And then in terms of the provide, so some of the statements that some of the group typed in, that the overall approach was reflective, tuned in, respectful, client-centered, and that also continues as we go into provide. This can be one of the spots that can get a bit sticky for us when we start to share information. We can lose engagement if we power over or share too much or too quickly or don't stay in tune with what's actually happening. So in terms of how to provide the information, the goal was to really take a non-threatening approach and to normalize the conversation. So as I started saying, you know, that this is new information for many women, so it's, you know, she's not feeling like she's the one that doesn't know, and that it's generalized statements that some women have experienced, what we know overall. And when you're sharing a lot of information, ideally what you want to be thinking about is doing a chunk approach. So you share the first piece of information. You might check in around what does she understand so far, or any questions so far. How I did that was I did an explicit pause. I slowed down, I paused, and then waited for her response to see what was coming up before going any further. And of course, there's always choice around how information is received. So saying, you know, would you want it in a website? Would you want something to take away and read? We could set up another appointment. And of course, why doing that? The priority continues to be engagement. The other important thing to consider when you're sharing information or resources is that you're paying attention to both wanting to address her importance, so raising the importance of the topic, as well as her confidence. Sometimes we can focus too much on raising concern, and we forget about wanting to build and support her self-efficacy, that there's actually something she could do around this. So part of what I mentioned was not only does the resource provide information about the risks, it also gives some ideas of what you might do to help reduce your risk. Now, because of the time today, I didn't go into what those would be. I would certainly in another conversation, or if I had more time with her, I would have gone into what were some of her ideas and what might be possible. So the focus is on information exchange. It's not provision. It's an exchange between the two of us, and that the relationship always lies at the heart of informing.
So elicit, provide, and then this final elicit. So after providing that information, asking what she makes of the information. So really you're eliciting her voice. It's, the research in MI is pretty clear that what she says stays with her. And so finding her words around it, she's making sense of it, and she's now verbalizing it and making sense of that information. So the reason that we do that is, again, it's active partnership. I'm talking, the client is talking also. It's supporting this ongoing connection. The connection is as important as the information, and I feel the client feels important in that. And again, as I said, evoking her voice, her understanding, her perspective. So it's really, empowerment is this active engagement that the client does have health choices and decisions that are possible and making informed choices. And also that final elicit provides the opportunity, you hear what she's heard of the conversation. There may be something that you want to revisit. There may be some misinformation or something that you're surprised about that she's taking away with her. And so it's that opportunity to check back in around what's staying with her in the conversation. So this pause for reflective practice, and as we move now into more information in this webinar, knowing that reflective practice, sometimes we go on autopilot when we move into sharing information. Our default communication style kicks in when we feel like we're under pressure, when there's things we have to say or want to say, and so this pause where we reflect back on how well did that last conversation go that I just had with a client, patient woman. And so we can ask ourselves some questions in that then help our skills to grow in this, our communication skills. We might ask ourselves, was she engaged in that conversation? How do I know that she was engaged? So one of the points in the role play we just did is I asked a question. Low-risk drinking guidelines, what risks are you referring to? I don't know enough about that. That was a point of real clear indication of engagement. You can ask, who did all the talking? Was the client actively involved in the conversation? And asking, what does she already know? You walk out of that conversation, did I ask what she already knew about the topic so that I could ask permission to share the information and then tailor the information to her specifically so it's making sense to her. I'm not telling her what she already knows so that she checks out of the conversation. Have you made the autonomy and her choices explicit? Have you said, it's up to you what you do with this? Right? It's just, this is information that other women have found helpful, so that you're tailoring the approach. And in the end, have you done that final elicit? Do you actually know what she's taking away with her? If you don't know that when you reflect back, you likely haven't asked or done that final elicit. So questions to consider. So over to you, Teresa, to see if there's any discussion questions.
Great, thank you, and good morning, everyone. I'm here to moderate this discussion and invite everybody to send in some questions, and I'll send them up to Nancy, Tasman, Francis, and Chris if you have anything. We've got a few minutes now, so if you have questions, you're welcome to send them in. And if they come within the next few slides, we have another question period at the end, so we'll always make sure that we get an opportunity to discuss and answer any of the questions you have. And if we can't get to all of the questions that the group may have, we'll also endeavor to respond to them by email afterwards. So I'll just wait a few minutes and see what...
Thanks,
Teresa, there was a comment in that role play that the information felt really high functioning. So we could start there. Again, tailoring the information. How we might, so I'm remembering the image you showed, Nancy, at the beginning with the women, and her head was 2 drinks a week and the man was 3. So we could visually share that information, simplifying it, slowing it down even further. So 10 drinks a week, pause. and have a visual around that. So that's that chunking out. So to simplify it and to help her digest it, watching her reactions to it. So you may really slow down that conversation and find out hear her voice, like 10 drinks a week. What do you make of that? That would have simplified and slowed down the conversation. Some visual aids would have been helpful.
Mm-hmm.
Super. Thank you. We have a question, Nancy, about the ability to get the presentation slides once the presentation is closed. Do you want to just respond to that?
Yes, we definitely will have them posted up on the website of the BC Centre of Excellence for Women's Health under the events section, and I think Tasman will also link them to the blog that will give you the address for near the end. So we'll definitely have the slides up for people to see, and the full recording as well, for those of you who've had some audio concerns along the way.
Super, thank you. We've got some really great questions this morning. One of them is, what are some strategies or ways to communicate if you find resistance to the engagement process? And can you give examples of phrases?
So in terms of time, do we want to address those now? Do you want to get some more information in the room and then have the final discussion? I'm wondering about our time here.
Okay, we've got a few minutes. We have some more additional questions if you'd like me to read those out as well. And it's highlights or key pointers when using MI or reflective practice over the phone. So we've got about 5 minutes left. And, you know, if you want to I think, to answer those, you know, I'm
Sure.
not sure how long it will take you, Fran, so.
Yeah, let's start. And Chris, you know, jump in. So the first one, so someone is pushing back. They want to be told. They don't want to be engaged in the information. Just tell me what to do. I think one of the things we would suggest, the most standard approach or the most common response is a reflection. So it sounds like what's underneath what she's saying? Tell me what to do. It sounds like you want some really clear guidelines and some advice in terms of how to think about this. That will work for you. I would reflect it back and pause for a minute just to make sure that that's what she's asking. She may really need to know that there is information available, and I'd say there absolutely is information I can share. And just wanting to build this conversation between us. And if she says nothing at that point, then I would start sharing the information. And then we're still back into that listen, provide it in chunks, and just probably really chunk it out, like the 10 drinks a week. What do you make of that, if anything? And just see if I can build more engagement even in that provision stage. Chris, would you add anything to that?
And I would add that if you're finding that sharing the information itself is heightening the discord of what's happening, you want to kind of put your agenda aside for that moment. It doesn't make any sense to continue forward so that you're able to say, well, I shared the information with her. The question is more a matter of, if you shared it with her, then what? What does that mean for her? What happened? And so you never want to compromise their engagement over sharing the information. So just slowing down, drawing back, explicitly making statements to stress her autonomy, that you know yourself best, those types of statements. What you choose to do with the information I share is up to you. And going right back to really listening to what might be behind what she's saying versus reacting to it. So if she's saying, well, I know all of this, or this isn't important to me, there may be something else going on. So listening at a deeper level and really kind of putting the pause button on. Sometimes the impulse could also be to start asking a number of questions. And that was one thing that we consciously wanted to demonstrate as well in the conversation we just had, was that it wasn't a matter of starting to delve into, well, exactly how big are her drinks and how often is she doing this and what else is going on. That would have compromised initial engagement. So it didn't become assessment. It was still about making connection and being in relationship.
Super.
That's,
Thank you.
well, Chris, let's move on now and just have a bit more information behind some of the resources, because sometimes I feel that it's helpful to the service providers to be really aware of the issues around cancer and other risks of drinking. Should the woman say, well, what do you mean by that? What about cancer and alcohol? And so I think, you know, it's great for us also to have resources like this where you could turn to one page only if that's all the area that she wants to know, or just for your own information in arming yourself as you prepare to have these conversations. So Tasmin is just going to tell you a little bit about the research we found behind these areas of women's health and alcohol.
Great. Thanks, Nancy. Good morning, everyone. So I just wanted to turn our attention to one of the resources that Nancy mentioned early on, which is this Women and Alcohol, a Women's Health resource. This is an update of a resource that was published a few years ago. You can see the old cover on the left and the new cover on the right. And the reason we updated the resource is for a couple of reasons. One was the release of the National Low-Risk Drinking Guidelines in the fall of 2011. As well, there's been a lot of research in the last 3 or 4 years that's kind of given us a better understanding of some of the risks associated with alcohol, especially for women. And we wanted the resource to reflect those changes and that new information. So for those of you who are familiar with the older resource, you'll notice that we've kept the same headings as before, and there's 6 sections in this 12-page resource. The 6 sections are on low-risk drinking, a section on health risks of drinking, another section talking about individual responses to alcohol and thinking about low-risk drinking within your own personal context, some information on considerations for women, which is reflecting some of the research on how alcohol affects women differently and some particular considerations, a section on supporting someone close to you, especially if you're concerned that someone you know might have concerns with alcohol use, and a section on resources. And the resources are both online resources where you can find more information, but also information on community services and opportunities for making connections and learning more. I'm just going to focus on the low-risk drinking guidelines at the beginning. Chris and Fan have already given us a great introduction to them. So the low-risk drinking guidelines were released by the Canadian Centre on Substance Abuse in November 2011. And basically they are trying to give suggestions for daily and weekly drinking limits, different for men and women, and other suggestions for minimizing the risks associated with drinking alcohol. So these are things like drinking slowly, drinking with food, alternating between alcoholic and non-alcoholic beverages. And the guidelines are not intended to promote drinking. Rather, they're really trying to give people information to make healthy decisions and also trying to support a culture of moderation around alcohol use. So there's quite a few resources available from the CCSA on their website, brochures, pamphlets, both for the general public but also for service providers who are trying to look for more information and ways of engaging with these ideas in their practice. There's also an excellent 2-page information sheet, which is here on the bottom right of the screen, which focuses specifically on women and alcohol and gets at some of the reasons why the guidelines are different for women as compared to men. One of the areas that we've chose to highlight in the health risks of drinking section in the resource is on cancer and alcohol. So we've known for quite some time that alcohol consumption is an important known cause of cancer, but we've learned more about what some of those risks might be. And the research is showing that drinking as little as 1 drink a day on average can increase the risk for developing breast cancer, cancer of the colon and the rectum, the esophagus, the larynx, the liver, the mouth, and the pharynx. I'm not going to spend a lot of time on this chart, but it's basically looking at what the risks are from how much alcohol you drink in terms of 1, 2, 3, or 4 drinks with some major illnesses and diseases. And what the chart is really trying to imply is that there's a real place to trying to find a balance of low and high risk, but also that risk can start just at 1 drink a day. When it comes to thinking about reducing cancer risk, if you're working with a woman who is interested in reducing her risk of cancer, the daily and weekly recommendations in the low-risk drinking guidelines need to be lower. And the Canadian Cancer Society has recommended that women who want to reduce their risk of cancer should drink less than 1 drink a day. But the key idea, though, is that any type of alcohol or any level of consumption does increase the risk of cancer. And the Canadian Centre on Substance Abuse has also created a 2-page information sheet specific to cancer and alcohol that might be a really good thing to be able to share with women if they have specific questions about this topic. We've also included some very brief information on alcohol and calories in the guide. And this is reflecting, I think, increasing interest around alcohol and diet and concerns about empty calories and how you should manage that in terms of your diet. So the per gram, alcohol has about 7 calories. So what that means in the real world is that a can of beer has 150 calories, a glass of wine has 125 calories, and a pina colada cocktail has 245 calories. So kind of thing to remember is that it's not just the alcohol content of a drink that dictates how many calories it has, it's also all the sugars and flavorings that we add to our drinks. So that's why the pina colada has significantly more calories, even though it's a smaller volume of a drink. One of the reasons we wanted to include this information is that when we think about marketing of alcohol, there's been a lot of what we call weight-conscious marketing. So we have things like Skinny Girl cocktails. We have an example right here of Mike's Hard Lemonade. Mike's Light, if you want more carbs, eat the box. So really this is kind of a fear or concern that is being brought up, at least in marketing. But what's interesting is that in the research, research has shown that when consumed in moderation, alcohol is not a major contributor to weight gain. So in our discussions with women, I think it's really, once again, talking about a balanced diet and encouraging and supporting moderation. Alcohol, stroke, and heart disease. So this is a particularly interesting area. We hear a lot about, isn't drinking a glass of wine good for my heart? Aren't there benefits to drinking? And that is definitely reflected in the research. We know that small amounts of alcohol can reduce the risk of certain types of stroke and cardiovascular diseases. But we also know that there's a point where the risks start to outweigh the benefits. At higher levels of drinking, alcohol can increase blood pressure and actually increase the risk of stroke and heart disease. So the question of at what point do the risks outweigh the benefits, of course, will be quite individual in terms of what their particular illness is, what else is going on in their lives. But generally, I think the 2 key ideas we know from the research is that possible health benefits are only relevant if you're having a conversation with someone who's middle-aged and onwards. If you're talking to someone who's 20, there's no point at which the benefits will ever outweigh the risks. Also, the possible health benefits of drinking are really apparent at very low levels. So we're talking about maybe half a drink to 1 drink on average per day. So anything higher than that will definitely increase your risk of a variety of other concerns. The last area that I'm just going to focus on is on pregnancy and light drinking. So the low-risk drinking guidelines emphasize that it is safest not to drink during pregnancy or when planning a pregnancy. And that's reflected in the resource where we say there is no known safe amount of alcohol at any stage of pregnancy that will completely prevent the risk of having a child with FASD. And we know from the research that it is very clear that at high levels of alcohol consumption there is harm to the fetus. But this question of light drinking, about having a couple of sips here and there, or having a glass of wine later in pregnancy, is something that gets discussed quite frequently and people have their own ideas about, and is also a hot topic in the media. So it's I think it's just really important to kind of know what the state of the research is on this topic. In terms of the research, when we're talking about low to moderate levels of alcohol consumption, the evidence is inconsistent. We know some studies show that there's no effect of light to moderate drinking during pregnancy, and there's a couple examples here on the screen. But we also have other studies suggesting adverse effects of light to moderate drinking, and those studies are saying that it's dose-related and that it's impossible to find a safe threshold at lower amounts of alcohol use. So given this lack of clarity in the research, what are some things that we should be thinking about? So the summary idea is that while the risk from light consumption during pregnancy appears very low, there's no known threshold of alcohol use in pregnancy that has been definitively proven to be safe. We also know that individual level factors such as nutrition, genetics, and other substance use can interact to affect outcomes. And we also know that there's a lot of potential for misunderstanding what a drink size is and how much alcohol is in a particular drink. And one of the areas of the research that is quite compelling for me is that when we do research on animals, which is where we can do things that we can't do with people, is that we see that even at low doses and any time during the pregnancy, we can see adverse effects on the fetus. So, I mean, that's some of the background behind why the current guidelines are encouraging no safe time, no safe amount, and no safe kind. So I think one of the questions becomes, how do we discuss this ambiguity in the research with women? Do we stick to the guidelines, or do we talk about some of the limits of the research? And there's some people who have been looking at this idea, and they're finding that women actually find it very helpful often to talk about this ambiguity in the research, and that it doesn't undermine our overall message that the safest choice is not to drink, but it actually strengthens the message's persuasiveness and can lead to some really good discussion and information seeking and some healthy decision making. So I'm going to leave it there and turn it back to Teresa.
Great. Thank you very much, Tasmin, for the presentation of the evidence. We've had a lot of questions come in. Some of them are going back to Chris and Fran's presentation, so if that's okay, I invite everybody else if you'd like to ask some more questions, but I'm going to point to a couple of key questions that were sent in at the end of that discussion. And one of them was, Chris and Fran, can you discuss how the conversation, so the MI conversation, would be different if the client was pregnant? Maybe you can sort of take us back to that in light of all of this information that Taz just presented.
Of course, every conversation is tailored, and this is a very tender conversation. If a woman knows, or if you both know that she is pregnant, then she's going to hear this information and possibly feel scared about it. Our goal is not to scare her. Our goal is not to shame her. Our goal is to have compassion, which means that we act on her behalf. And part of how we do that is there's lots of reflections and pauses so that she can just integrate, and we can just notice how it's a trauma-informed response, that we can notice if she's moving into some trauma, maybe help her ground in it. So we would slow the conversation down and in compassion offer her hope that there's other factors to consider. As Tasmin was just saying, her nutrition, her genetics that have influence. We also offer her compassion by helping her look forward in terms of what the next steps that she may do as she continues in this pregnancy to have the healthiest baby possible. And so help her, empower her in terms of the next steps around that. She may want a referral. She may want to really discuss this further with a specialist. That would be a compassionate response if that's what she's asking for. So those are some of my comments on that. Chris, do you want to jump in?
So I would also add really giving her a sense that she's not alone. Obviously the specifics of the situation would come into play. If we're thinking of a situation though, where a woman potentially didn't know she was pregnant, letting her know that it's not uncommon that women actually don't know that they're pregnant and they've had a drink before knowing that. And then the piece, as Fran said, what you might specifically ask is what else is she doing to take care of her health and have a healthy pregnancy. So you're kind of, as Fran said, looking forward, noticing what she is doing, not just getting stuck in what isn't happening and all of the risk. So looking at how is she keeping herself safe, what is she eating, prenatal vitamins, what else is she doing that will impact the overall health of her pregnancy and her health.
Super. Thank you very much. That was a really informative answer. I appreciate that. I'm just going to ask one more question because we're coming up to the end, and I thought it was a really good question, and that you would provide some brilliant advice on this. And the question is, do you find there are clear language or even language differences, words or phrases you would use when having discussions with women of differing educational levels?
Certainly, and this is what we're we're hoping that we're stressing is that you are always tailoring your approach and being conscious of not using jargon depending on education level, backgrounds, whatever is going to make the most sense, age appropriate. Fran already mentioned earlier, possibly using visuals, diagrams. So no matter what, you are always tailoring your approach. And so the hope is knowing that these resources are out there, that then ultimately you take a look at some of them and think, okay, how do I make this work for me, for the women I support, for the families I support in my specific context?
I would add to that, if you haven't seen it already, the Native American manual that translates MI into language specific to First Nations. That's very helpful. Their images are helpful. Their language is helpful. And when I'm engaging with somebody, I'm always watching for their response. So, and I would say, if there's any jargon I use or any language I use, don't let me get away with that. Let's build this conversation of understanding between us. And so that, I have an example of a group, and I was running a group, and I was using the simplest language I could, and I just couldn't find the language. And in the middle of this group, a woman came and sat beside me, and every time I spoke, she would then look to the group and she would say, "Let me tell you what she's just said." And it was the best thing because there was such engagement with it. So I think it's also inviting them to help us find our words, help us understand what would be helpful to them. It may not be words, as Chris said, it may be pictures. But it's a mutual responsibility, this understanding, and we are looking for all kinds of indications. If she's following, if it's clear, and if not, then invite her to help us with that.
Super. Thank you very much. That's a wonderful example, Fran, and I appreciate that. And I'm sure our audience appreciates that as well, always checking in with that. Nancy, shall we turn it back over to you?
Sure. I've answered a few questions in the chat around links for girls and binge drinking and around where to find the slides, or in the Q&A section, where to find the slides post session, but I just want to go over that again, that the slides post-session will be on the BCC, the British Columbia Centre of Excellence for Women's Health website. The second one of the ones shown here, and also connected to the blog that Tasman moderates on FASD prevention, and I really encourage you to check out that blog because I think it really does offer some great ideas for how we have discussions about alcohol and other things together and not just focusing on alcohol alone, as Chris and Fran have really well demonstrated today, that the conversation may end up in another place depending on what's behind her alcohol use, and so these conversations are really open-ended in many ways indeed. Just wanted to also mention that all of these materials we've talked about today and more, including some demonstration clips of motivational interviewing that Chris helped make a few years ago, will all soon be up on this BC Women's Hospital and Health Center website. They're doing just about to launch, didn't have it quite ready for today, this website, womenspopulationhealth.ca, and there will be a whole section on women and alcohol in that area on that website. So I encourage you to think about following up there in the long run. And of course, Teresa's been able to post this resource we've been focusing on today, the Women and Alcohol one, on the BC Ministry of Health website, which is terrific to, if you want to download it following this webcast. And I just wanted to mention as well that we do have some print copies of that resource. You know, many of us just like to go to the web and look at things on the web, and that's great. But sometimes it's helpful to have some, you know, actual visuals in your hand as you're talking about it and giving women options about whether they'd like to go to the web or would they like to take something home to read. And if you have a few copies available of resources like the one we've been talking about today, it can sometimes, you know, really be inviting of women's further action, which is what we're really hoping for. So if you are interested in getting some copies of that resource that are in print, we have limited amounts that people can order from the email that's at the bottom of this slide, the General BC Centre of Excellence for Women's Health email. So that's something that you can be thinking about as well. One more thing is that we are hoping to do the next in the series of these webinars on June 12th at the same time Pacific, and we're going to have some of the same players back to talk a little bit about, and some more other folks as well, about trauma-informed approaches to having these discussions. So really emphasizing that link that may be there for some women who are having difficulty reducing or stopping their drinking because they see it as a way of coping with experiences of trauma or violence. So really trying to think about how we link up these conversations to be even more complex than the one we've been able to demonstrate today. So thank you, one and all, for attending. We'll be following up to some of these questions as well, and really appreciate your engagement and your interest in this important work. So bye for now.